We're talking about the dreaded double chin this morning, a common yet undertreated facial condition. There's a new FDA-approved filler that reduces fat in the chin, and here to show us how it works is Dr. Sherry Ingraham with Advanced Dermatology and a brave patient that you've brought along. Good morning to you both.
Thank you.
So what is the name of this new product?
So this is Kybella, and what Kybella is deoxycholic acid. Deoxycholic acid is a natural substance occurring in our bodies, and this is the synthetic form of it. And in our bodies, it emulsifies fat. It acts as a bile acid. In this product, what it does is when it's injected into the submental area or this double chin area, it actually melts away the fat by lysing the cell membrane of the fat cells, and the fat contents are then released into the body, and the body metabolizes them, and those fat cells cannot come back.
Very interesting. I said brave patient because you're actually going to inject her this morning. How many injections are you going to do?
In Susie, she has a rather large area, and what we do is we mark the patient. So we're very careful to mark the patient, avoiding important anatomical structures. And one of the potential side effects of this treatment is you can actually get marginal mandibular nerve damage, which is a nerve involved in smiling. Smile for us, Susie. So we always want the patient to smile first. We mark the patient out very carefully so we avoid the area that nerve innervates and stay in the submental area where the preplatysmal fat is. And so she's got about 25 dots in there. So we'll usually do about 5 syringes in a patient like this. And Susie can tell us in a moment how it feels, but typically you can feel a little slight burning sensation.
She has been numbed. We should warn our viewers. Susie, are you feeling that sensation at all?
I'm not feeling anything.
You're not feeling anything? Good. So the numbing mechanism worked well then for you, right?
Some patients don't feel very much between icing and numbing, and she actually took a little ibuprofen before the treatment, which can help, and then we will have her take ibuprofen 3 times a day for the next several days, because patients can get some swelling and bruising and also a little bit of discomfort, but we found that giving them ibuprofen 3 times a day for several days can help with all those side effects.
And why is Susie a good candidate for this?
That's a good question. Susie is a perfect candidate because if you look at Susie from the side, she's got a nice chin, but in her jawline you can see that the platysma muscle, which is this muscle, clenched down like this, clenched down like this. The platysmal muscle here is actually in Susie not that prominent, but what is prominent is this fatty tissue here. Is this something that's always bothered you? Yes. What we find with patients is this fat is not necessarily dependent upon how much weight they gain or lose. If they exercise, it can be, but oftentimes it's genetic. So we do see many men and women who are what we consider to be normal body weight who've struggled with this fatty tissue their entire lives because their family members also had it. And so it gives them an opportunity to treat it.
And you've called this product a game changer before.
Right.
Why do you say that's a game changer in this field and attacking this problem?
Huge game changer. Before, the only thing we could offer someone is platysmoplasty, a plastic surgical procedure where they plicate the platysmal muscle, or actually liposuction of the chin. A lot of my patients are coming to us because they don't want to go under anesthesia, they don't want to take time off of work and have surgery. We can do this. You're going to go back to work today, right? We can do this treatment.
Perfect.
She can go back to work. She will be fairly swollen. People will notice the swelling, but there's not a lot of downtime with the procedure, and there's no other substance FDA approved to do anything like this.
Real quick, we're running out of time, and as we look at those before and after pictures, you can see it is a dramatic improvement. Dr. Ingraham, what is the cost? Do we know that yet?
We don't know the cost yet. A handful of physicians, including myself, were chosen to become trainers where we actually have to train other physicians to do this product. We can go ahead and inject patients with it, but we'll be getting the pricing information sometime in the next week, so we're excited.
All right, thanks so much for coming in, letting us know about it, telling us how it works, and we wish you a very fast recovery. Sounds like it will be.